Hello friends, cataract is one of the most commonest conditions affecting a lot of individuals above the age of 50. It is the largest cause of blindness across the world, but it is a curable problem, and that's the good part of the whole story. It is the largest cause of blindness in developed countries and developing countries like India. It starts very incipiently and most people don't even realize that their vision is going down. Earlier, people used to think that cataract starts only after the age of 60, 70, 80. But in today's urban population, across the board, we see that cataract starts even earlier, after the age of 35, 40, 45. Excessive exposure to ultraviolet rays, lack of vitamins, other hormonal problems, diabetes, these are things which can precipitate cataracts in even normal individuals. What happens in a cataract? You have a crystalline lens in the human eye which allows light to go through very clearly without causing any obstruction. But when the lens becomes opaque, depending on the grade of opacity, your vision starts getting fuzzy. You may see double vision, you may see fuzzy lights, you may not be able to read the ticker on television, you may not be able to see the number on the car in front of you, you will find problems reading your cell phones. But more importantly, cataract develops in one eye more than the other. God is generally very kind. And which is why a lot of people come late to us. Because when both eyes are open, you will never come to know which eye is seeing less. So for all individuals above the age of 30, I recommend, with or without your old glasses, whatever you are used to seeing, once every fortnight, cover each eye individually and watch that ticker on television. If it becomes fuzzy or if you cannot read, it's time you went for an eye checkup. If there is some injury with a cricket ball, squash ball, football, you need to get your eyes examined quite rapidly. On a routine, diabetics must do it once in a year. But when you feel that your vision is going down, it is imperative to find out, is it because of a curable thing called cataract, or is there any glaucoma or retinopathy in diabetic people? Now let's talk about cataract further. As the opacity in the lens becomes more and more thicker, your vision starts going down. And a lot of fractures above the age of 50, 55 that we see in people is because their depth of field was not proper and they missed a step. And quite often they blame their cell phone that they were trying to call on the cell phone. It is very important to rule out that your visual clarity is good, to have a good quality of life at home, in office and in driving, and for your own safety. Once you are diagnosed with a cataract, you should be very clear that it's a solvable problem, which is so very good. Because God will give you problems, all of us will agree, after the age of 40. And if He gives you a menu to choose from a heart problem, cancer, prostate, if you are given a choice, if I were you, I would choose a cataract. Because it's a reversible problem. Earlier, people used to wait till they become blind. And the good old saying was, motiya peak jana chahiye. What is peak or what is mature cataract? If we wait for the cataract to grow, one fine day you will not be able to see anything. That is called a mature cataract. Nobody in today's world wants to wait till they become blind. We all want to do our routine day-to-day chores. You want to work in the office, enjoy television, do your WhatsApp, Facebook, work on your computers. So get on with it, and the modern technology enables you to move on faster, recover faster, and get going with your job. What exactly happens in a cataract with the surgeon? You are given a few investigations. Once you are fit to undergo any surgery, you are called upon into the clinic in the morning or whatever time chosen. You spend a couple of hours in the clinic or the hospital. In the operation theatre, you might spend less than half an hour or 45 minutes. And with today's technology, it has become so very user-friendly from the patient's perspective, because there is no injection, no stitch, and no pain relatively compared to any other surgery, nor does it require any hospitalization. And within a couple of days, you are fit to resume your work on a routine basis. What more can technology give us today? Coming to technology, the machines have undergone a sea change in the last 30 years. The latest is the femtocataract surgery with phacoemulsification, wherein the lens is broken into small pieces, churned out, and following that, an intraocular lens implant is put in the place where God made the original lens to be. An intraocular implant on a magnified view looks like this. This is a very magnified view, but it is generally 6 millimeters optic and a 12 millimeters overall diameter. This stays in the eye for the rest of your life. It does not need any change. And the present material, which is the best in the world, is the hydrophobic acrylic material, which is extremely good, non-reactive to human body, and has a lifetime with you till the end of the day. The clarity of vision is also phenomenal. There have been advances because humans by nature wanted to be greedy technologically and wanted to have more and more, did not want to wear glasses. So cataract surgery has now become not just curative surgery, but restorative surgery or refractive surgery. Most often than not, after cataract surgery, however big the number you were wearing prior for the last 50 years, with the newer technology in lenses, 90-95% of your waking time, you will end up not using glasses. And which is why cataract surgery has undergone a sea change, little to be worried about. It is more than 99.9% safer. Of course, it's safer than flying over a war area or a war zone. It's safer than driving in Mumbai or safer than driving on the autobahns. Life couldn't make it more safer. Do not be scared. Approach a near doctor for your treatment. Get over with the whole problem and enjoy the quality of vision, the colors and the beauty that nature has in abundant plenty. Thank you very much.